Okay, today we're going to talk a little bit about nipple confusion and the process of going from the bottle back to the breast. Lots of times babies are born and they're able to experience skin to skin right away, and they're able to have a baby-led latch or self-latch, but sometimes there are things that happen during the labor and birth process that sabotage our first breastfeeding experience. One of those things can be giving the baby infant formula from a bottle before they're able to latch onto the breast. One of the problems is when babies are fed from a bottle, the flow of fluid is very rapid. And then just the slightest compression on that nipple and the fluid really flows. When the baby is given the bottle, and that's their experience on how to feed, and then they're given the breast, sometimes it leads to some confusion. The problem is when the baby is on the breast, they have to suck on the breast around the nipple area in order to release the oxytocin, which makes the milk flow. So they'll come to the breast and they'll try the slight compressions that they're used to getting fed through, and nothing comes out because there hasn't been enough action at the breast to stimulate the milk letdown. So there are two things we can do. The first one is we can use a pump to get the milk flowing for the baby. With the pump, you just make sure you center the nipple in the flange, and then you start to pump. For the pump to be the most effective, you find the maximum vacuum with comfort, meaning you turn the vacuum up to the highest strength, and then when it starts to feel uncomfortable, you go back. So you want it to be a very strong suction, but you do not want pain, or that will actually make it more difficult to get milk flowing. The other option is to use a periodontal syringe. The reason these are effective is, one, the shape. It curves so it can fit nicely beside the nipple. And the other one being, you're able to give the baby instant gratification when baby begins to suck. So you have the nipple and the tip of the syringe in the baby's mouth. When baby sucks, you reward baby instantly by putting fluid alongside the nipple. And baby will continue to stay at the breast because he's getting fed, which will also make a letdown come in quicker, and the stimulation at the breast and feeding at the nipple will get the baby back on breast. So first we can try pumping and priming the pump and getting the milk flowing for the baby. And if that's not effective, I recommend the periodontal syringe beside the nipple and giving some instant gratification so baby gets fed immediately and will stay at the breast. So try those two things, and let's get the baby back on the breast and get breastfeeding back on track.